Welcome to my virtual presentation. I'm Dr. Kibet from the Center for Open Distance and E-Learning, Machakos University. In my presentation today, I will be discussing about how to treat deep and painful pimples and acne. To start us off, the images you see here, the first one is the extent of the damage by acne. Look at the skin, how damaged it is, how it has been damaged by the acne. And the second one is an image of the attack of pimples. So these two photos shows how the damages that acne and pimples can do to our skin. Now, first let me give the meaning or the definitions of the two terms. Pimple. What is a pimple? A pimple is a small, usually inflammatory swelling or elevation of the skin, papule or pustule. Acne. An acne is an inflammatory disease of the sebaceous glands characterized by comedones and pimples, especially on the face, the back, and the chest, and in severe cases by cysts and nodules resulting in scarring. If you have ever gone to bed with a clear skin and woken up with a massive painful pimple on your face, you are not alone. Yes, there are millions of people affected. Although acne comes in many forms, including blackheads and whiteheads, the most severe type of acne is a pimple that develops deep in the skin, causing a red, swollen, and painful bump. There are ways to tackle this type of acne at home to alleviate pain and reduce the pimple size, swelling, and sadness. So how do we do it? The following do's and don'ts I'm presenting below is what we can do at home to fight pimples and acne. 1. These are the do's. Do wash your skin before treating it. Use a mild, fragrance-free cleanser and be gentle to your skin while washing. Number 2. Do apply ice to reduce pain and swelling. Rub an ice cube in a thin cloth and set it on the offending spot for 3 to 4 minutes. Number 3. Do apply a product that contains 2% pencil peroxide to the pimple. Number 4. Do apply a warm compress once a whitehead begins to form. To make a warm compress, soak a clean washcloth in hot water. Make sure the water isn't too hot to avoid burning your skin. 5. Do use makeup with salicylic acid. Salicylic acid is a common acne ingredient that is useful in preventing or treating pimples. Number 4, 5, 6. Do apply a paste made of crushed aspirin. Aspirin contains salicylic acid, which is a top-shelf acne fighter by all products. Number 7. Do change your pillowcase. Keeping your pillowcase clean is a top beauty secret. Pillowcase can hang on to dirt, oil, and bacteria from our face, hair, and environment, and can become a breeding ground for pimples or acne. Number 8. Do resist the urge to squeeze. It's never a good idea to squeeze a pimple or acne. 9. Do avoid trigger foods like skim milk. 10. Consider using zinc supplements. And lastly, number 11, do seek out a dermatologist if your pimple or acne escalates from a few lone bumps to persistent cystic acne. Then consider booking a dermatologist appointment. Now, let's look at the don'ts. These are the things that you should never do with pimples or acne. Number 1, don't pop, squeeze, or pick on the blemish. Picking tends to cause more harm than good. Number 2, don't apply toothpaste to the area. Toothpaste contains several ingredients that can clog your pores and irritate your skin, such as hydrogen peroxide, baking powder, alcohol, and methanol. Number 3, don't apply homemade treatments found online. Number 4, don't over-try the affected area. Let's look at number 6. Number 5, don't wear makeups with poor cloaking ingredients. People who suffer from acne should avoid makeups that contains mineral oil or lanolin. Number 6, don't believe every DIY hack you see. While it is tempting to mix up a cure-all, which sprue of whatever trying agents you have in the house, so try to avoid. Don't opt for stronger cleanser. Swapping your usual face wash for something harsher seems like an obvious fix. Not quite. Avoid. And lastly, don't limit acne treatment to just your skincare products. Sometimes acne is caused by or worsened with certain hair products you may be using. So that marks the end of my virtual presentation. And in this presentation, we've looked at what we need to do to deal with the painful pimples and acne. Thank you, and bye-bye.